Hi everybody, it's the biology doc here for Trust Me, I'm a Biologist, and I'm going to take some time today to do a little video with you on understanding cardiac access. Hopefully this should take less than 15 minutes. Now, the reason I'm doing it is because a lot of my students have trouble understanding what the concept of cardiac access is, because it really is a very abstract concept. So the first thing we're going to do is we're going to draw a heart, okay? And it might help if I have the right tool selected. We're going to draw a heart. And it's just a rudimentary heart. So there's an atria. There's a ventricle there. We're going to do another atria here. And another ventricle here. Obviously not drawn to scale. We're also going to leave out the valves. So you've got an atrioventricular valves around here. Most importantly though, we got sinoatrial node up here. And the atrioventricular bundles coming out there, including Bachman's bundle, which never gets enough love. In the middle here we got the atrioventricular node, and its job is to just slow down the action potential as it's propagating through the ventricular myocardium, not the ventricular myocardium, just the myocardium, down into the ventricles, along the bundle of His, which splits into the left and right bundle branches, and up into the Purkinje fibers. Left and right bundle branches into the Purkinje fibers up here like that to carry the wave of depolarization right the way through the heart. So like I said, we've got the atrioventricular valves here, and we've got the aortic and the pulmonic valves at the top. Now, there's a couple of things we've got to remember in order to understand how the electrical waves propagate throughout the heart, and that is that when we're doing a heart contraction and when we're propagating a wave of depolarization through the heart, there is not one synapse to be seen. Okay? There is no neurotransmitters going on here. This is just a wave of depolarization passing directly from cell to cell, because the cells operate as a syncytium. In other words, when one of them depolarizes, i.e. the sinoatrial node, it will take the rest of the atria with it. Now, the wave of depolarization can't pass through the atrioventricular valves down into the myocardium unless there's something wrong. So the atrioventricular node picks up that wave of depolarization and it just pauses everything ever so slightly so that the atria contract, top the ventricles up with blood. The heart can then stretch. The wave of depolarization passes down the bundle of His into the Purkinje fibers, and the heart contracts from the bottom up. And what we want to do when we're doing an ECG is we want to measure this activity. So we come along and we put an ECG electrode on our participant's right arm. So this is left as I'm looking at it, so this is the right arm there. Okay, we come along, we put another one on the left arm, and we put one down on their left leg. Now this is otherwise known as the foot. You can put one down on the right leg as well as a neutral, but for all intents and purposes, it doesn't matter. So as a matter of fact, what I'm going to do is I'm just going to get rid of this for the sake of being neat. Okay, so what we do when we put these electrodes on and we turn our ECG on is that we set up some bipolar leads. In other words, these are leads that have got a negative and a positive electrode. And this is ECG lead 1, and it looks across the heart, from right arm to left arm. We've got another one then that looks down from the left arm towards the left leg. Okay, and I'm going to draw it in here, like this. And it's got a negative at here, and it's got a positive end down here, and this is ECG lead 3. And then we've got another one that comes down from the right arm down to the left leg, looking across the heart this way. I'm not going to draw it entirely through the heart because my OCD won't let me. And it's got a positive end down here, and it's got a negative end up here, and this is ECG lead 2. Okay? And these three leads together are called Einstein's Triangle. Okay? Now, we can draw these like this, but what you have to understand is that these are basically just measuring electrical vectors that are going on in the heart. So as our heart Excuse me a second. Sorry about that, I just lost my diagram. So as our heart depolarizes, we are propagating a wave of electrical activity throughout each of these cells. So in other words, we've got millions of little vectors firing off in all the different atrial myocardial cells. Okay? Now, the first question you should be asking yourself is, what is a vector? Well, a vector is just a mathematical or electrical concept that has two things. One, it's got magnitude. And two, it has got direction. Magnitude and direction. And this is the kind of thing that you do in kind of year 3A level maths. So typically you'll be set a problem where you've got a vector that is pointing like this and a vector that is pointing like that, and then you've got to solve and you've got to find the resultant vector. So what you do is you say, well, this implies that you take that one and you add it to that one, and then the resultant vector is this. So you just added that one, and you've formed that. Okay? So that's fairly straightforward. And that's what we're doing when we're trying to find what the axis of the heart is. What we're looking for is when you add all of these little vectors that are going on together when the atria depolarize, and when the wave of depolarization gets passed down through the atrioventricular node, down the bundle of His and into the Purkinje fibers, when all of those vectors, those millions of teeny tiny little vectors, when they get added together, which way is the resultant facing? That's it. That's all we're doing. Okay? Now, we can't, unfortunately, just answer this question from those three leads alone. Einstein's triangle is very clever, but we need some extra information. Okay? So what we need is the rest of the leads that Einstein's triangle generates. Now, what the ECG will do is it will take this electrode, it will take this electrode, and it will mathematically put them together down here. And it will create another lead, looking up at the heart this way. And this lead is called the augmented vector to the left, lead AVL. It'll take this electrode, it'll take this electrode, and it will put them together over here, and it will look up at the heart this way. And it is called the augmented vector towards the right. It will take this one, and it will put them together here, and it will look down at the heart like that, and be called the augmented vector towards the foot. Now, this is all well and good. What it especially does, because these are just vectors, these are just mathematical electrical concepts, we can redraw them. Okay? We can redraw them at the center of the heart. Okay? So what I'm going to do is I'm going to click and drag these leads. So I'm going to take lead 1, I'm going to pick it up, and I'm going to put it over here, and I'm going to touch it down so that its negative end is in the center of the heart. There. I'm going to draw it like that. There. Lead 1. I'm going to take lead 2, and I'm going to pick it up, and I'm going to put its negative end here, in the center of the heart. I'm going to draw it down here like this. Lead 2. I'm going to do exactly the same with lead 3. I'm going to put it here, so that its negative end is here. So this is the positive end. Positive, positive, positive. Lead 3. I'm going to take AVR. I'm going to pick it up. I'm going to put it here. And there it is. AVR. I'm going to take AVL, and I'm going to pick it up, and I'm going to put it here. Like that. I'm going to take AVF, and I'm going to put its negative end there. Like that. Okay, so all we've done is we've just picked up these leads, and we've just drawn them in a different way. And this is called the hexaxial diagram. You might also see it written as the Cabrera diagram. Okay? And that's all we've done, because they're simply vectors. We were able to pick them up and move them around and replace them to make it easier to read. Now, if we want to get really technical about it, we can actually say where these would be if you were to put them on a protractor. Okay? And this one would be 30 degrees. Okay? Lead 1 is at 0 degrees. Lead 2 is at plus 60 degrees. Lead AVF is at 90 degrees. Lead 3 is down here, and he's at 120 degrees. Lead AVR is minus 150 degrees. And that's it. We've got everything. Okay? What we can now do is utilize this diagram to look at an ECG and to read the axis. But that's for another video. Today, all I wanted to do is to get through why we do what we do and why this diagram looks like it does. If you would like me to do a video on the electrical properties of the heart and how the action potential propagates, I'm more than happy to do that. All you need to do is leave it in the comments below. Don't forget to like the channel for more stuff on biology, physiology, as it relates to medical sciences, sport and exercise sciences. I'm even happy to do GCSE and A-level revision on anything at all to do with biology. Just make sure you like the channel. Point me out to your friends, leave me some comments, let me know what you think of the video and what you think you'd like me to do next. What I can tell you is that my next video that I'm going to do without anybody asking for it at all is how to utilize this to read the axis of an ECG. Good luck, guys.